Hello, welcome again to my channel. Thanks for coming to see me today. The topic of my video today is infection control. My goal is to assist all my students to be successful in their fundamentals of nursing exam. We do not want our students to repeat fundamentals. We want them to pass the first time. My videos at the bottom of the page starts from chapter 1, chapter 2, chapter 3. It comes all the way up. There is no need to fail your fundamentals of nursing exam. Okay, with infection, we will start. Streptococcus bacteria is responsible for more serious diseases and fatal infections. There are two types of sterilization. Physical and chemical destroys microorganisms. Normal defense mechanisms against infections is the skin, mouth, respiratory tract, urinary tract, gastrointestinal tract. Those are our normal defense mechanisms against infection. Hand washing ranks as safety. When changing linens before and after procedure, wash your hands. Hand washing is for 30 seconds. IV tubings, we will change your IVs every 72 hours. Prevents infection, prevents thrombophlebitis. Assess the IV sites for redness, swellings, warmth at the IV site. You do not have to wait for 72 hours before changing them. If they need to be changed, please change them. Handle all body and blood supplies from patients as if they were all contaminated. For eye infections, we have conjunctivitis. These patients for eye infections will go in private rooms and will use gloves and gowns for these patients. TB patients go into our negative pressure rooms. Standard precautions, all patients are on standard precautions. All patients, we will wash our hands after we remove our gloves. C. diff patients, running water. For standard precautions, we will think about blood, body fluids, secretions, excretions, non-intact skin, mucous membrane. Use face shields when necessary. Avoid splashings. Avoid splashes from blood. When we talk about standard precautions, we need to clean our equipment in between patients, one room to the other. Make sure equipments are clean before moving them from one room after the other. Housekeepers do clean them at discharge, but if they need to be cleaned while a patient is admitted, please do not wait for patients to be discharged before cleaning these equipments. Place contaminated linens in leak-proof bags. The red bags are for blood products. The red bags are for blood products. Use needleless devices, safety devices. We're trying to decrease needle sticks. Needle sticks, report to your manager first. That's a test question. We're trying to prevent sharp injury, clean all spills of blood and body fluids with solution of bleach and water. We can notify the housekeeper to help us with spills, but we have to clean them ourselves, and the housekeepers will come in and disinfect with bleach or water. They are not going to clean the blood and the spills for us. Medical asepsis or clean techniques inhibit growth and transmission of microorganisms. Nosocomial infections are found in all hospitals or healthcare facilities. Hand washing prevents nosocomial infections. When we remove our gloves, we are washing our hands. Our hospital facilities are supposed to make report to infection control department within 3 days of admission. First step to prevent tissue breakdown is to use clean gloves to protect the skin and reposition our patients. Our isolation techniques are standard precautions, airborne and droplet precautions. We will use our mask, contact precautions. OSHA, OSHA, Occupational Safety Health Administration, is responsible for safety in the workplace. This is a test question. OSHA. Use sterile instruments and devices. Keep them disinfected. Keep environments disinfected. Keep surfaces disinfected. Use sterile instruments. Handle laundry with care. Use gloves. When patients come to the floor, make sure they are placed in the correct rooms. Make sure TB patients are in negative pressure rooms. Do not put TB patients or suspected patients of TB in a regular private room. We need negative pressure. All our isolation patients, we need the signs outside the doors. When patients are traveling to maybe x-ray or dialysis, if our patients need masks, they need a surgical mask to travel with outside of the patient's room. Or TB patients, do not give them an N95 mask to travel with outside the room. They need a surgical